Hi, I am one of the pediatric surgeons at UCSF Benioff Children's Hospitals. I wanted to take some time to explain a little to you about your child's diagnosis, how we will treat it, and what you can expect before and after your child's procedure. Based on the tests we have performed and the history you provided, we think your child has acute appendicitis. I'm going to draw some pictures to help explain what it is and how we treat it. If this is your abdomen, you have your ribs up top, the pelvis on the bottom, and the belly button in the middle. Inside, you have small intestines, which connect to your large intestines, also called the colon, so you have one very long tube on the inside. The large and the small intestines join together on the right side of the abdomen. This is where the appendix lives. It's like a little tail that hangs off of the intestines, and it doesn't serve any purpose. When the appendix becomes infected, we call this acute appendicitis. This can happen because a little piece of food or poop gets stuck in the appendix and blocks it from draining. This causes the appendix to become swollen, inflamed, and then infected. If left untreated, the appendix becomes like a water balloon that can even rupture or pop so the infected fluid can leak out. Appendicitis is very common and there's nothing you or your child did to cause it. When the appendix first starts to go bad, it can cause fevers, decreased appetite, diarrhea from irritating the colon and large intestines, nausea or vomiting from bothering the rest of the intestines, and most commonly pain in the lower abdomen, which can be worse with walking or moving the leg by irritating the muscles that control your child's hip. Once we think someone has appendicitis, starting antibiotics is the most important thing. Antibiotics alone may be used to treat appendicitis in some places and will keep things from getting worse while waiting for surgery. Here at UCSF, we often recommend surgery to help reduce the risk of having appendicitis again. If caught early, we can usually take the appendix out laparoscopically, which means using 3 small incisions or cuts to insert a camera and fill the abdomen with air. We then use instruments skinnier than a pen to take the appendix out through the belly button. If the appendix has not ruptured, we will let your child eat and drink and hopefully be able to go home within a day of surgery. Your child will be allowed to move around and shower the day after surgery and go to school within a week, but they should avoid strenuous activity or organized sports. Please look at your child's discharge paperwork for detailed information about restrictions, pain medication, and reasons to call or return to the hospital. While complications are less common after a non-ruptured appendix is removed, they can happen and it is important to call with any questions or concerns.